autonomic nervous system. So I've kind of mentioned throughout, the parasympathetic and the sympathetic divisions interact with one another. Most of our visceral organs have dual innervation, and the action potentials will continually fire down axons of both divisions. That produces a dynamic antagonistic interaction, and that works to precisely control the visceral activity. So both autonomic nervous system divisions are partially active, and this is what we call the basal sympathetic and parasympathetic tone. One division usually predominates, but in a few cases the divisions have a cooperative effect. So depending on what you're trying to do, sometimes you want to turn up some organs, turn down some organs, but there are some organs that you want to either turn up in both cases or down in both cases. So let's look at those antagonistic interactions. That dynamic antagonism allows for the precise control of visceral activities. Again, think of our teeter-totter, think of negative feedback, fine-tuning of control. So the sympathetic division is going to increase the heart rate and respiratory rates, and at the same time it will inhibit digestion and elimination. Whereas the parasympathetic division is going to decrease heart rate and respiratory rate and allow for digestion and discarding of wastes. Almost all the blood vessels of the smooth muscles are entirely innervated by sympathetic fibers only, and that allows this division to control blood pressure, even at rest, by controlling the diameter of the blood vessels. Sympathetic tone, or vasomotor tone, is a continual state of partial constriction of those blood vessels, so that if blood pressure drops, sympathetic fibers will fire faster than normal and increase the constriction of blood vessels. That will rise blood pressure. If blood pressure rises, the sympathetic fibers will then fire less than normal, and that will cause the less constriction or dilation of vessels, and that will lead to a decrease in blood pressure. So that allows the sympathetic system to also shunt blood to where it is needed by controlling the diameter of those vessels. Parasympathetic division normally dominates heart and smooth muscle of the digestive and urinary tracts, and it activates most glands except for the adrenal and sweat glands. It works to slow the heart and dictates a normal activity level of the digestive and urinary tracts. So these organs also exhibit a parasympathetic tone, where they are always slightly activated. Sympathetic division can override those effects during times of stress, and drugs that block the parasympathetic responses tend to increase heart rate and cause fecal and urinary retention. They do have cooperative effects. The best example of cooperation between those divisions is seen in the control of external genitalia. So parasympathetic fibers have to fire to cause vasodilation, responsible for the erection of a penis, and the sympathetic fibers then have to take over to cause the ejaculation of semen in males and contractions of the female vagina. The adrenal medulla, sweat glands, erector pili muscles, kidneys, and almost all the blood vessels only get fibers of the sympathetic division. The other unique functions of the sympathetic division include thermoregulatory responses to heat, so that when body temperature rises, sympathetic nervous fibers will cause dilation of skin blood vessels, allowing the heat to escape, and activate sweat glands. As the body temperature drops, the blood vessels would then constrict. They release renin from kidneys. Sympathetic system causes the release of renin from kidneys, and that in turn activates a system that increases blood pressure. There are metabolic effects to the sympathetic division. It increases metabolic rate of cells, raises blood glucose levels, and mobilizes fats for use as fuels. There are localized and diffuse effects. The parasympathetic division tends to elicit short-lived, highly localized control over effectors, as acetylcholine is quickly destroyed by the enzyme acetylcholinesterase, whereas the sympathetic division tends to be longer lasting with body-wide effects. Norepinephrine is not inactivated as quickly as acetylcholine, and norepinephrine and epinephrine are also hormones that are produced by the adrenal medulla, and they have prolonged effects that last even after sympathetic signals stop. So 14.5 gives you an overview of target organs, the effects of both parasympathetic and sympathetic division on them. And I encourage you to review that, as does the second part of that. Homeostatic imbalances. So we do get autonomic neuropathy, which is damage to autonomic nerves. It is a common complication of diabetes, and there is a very tight and very fine-tuned regulation between sympathetic and parasympathetic in sexual function. So that is one of the things that might be an early sign of autonomic neuropathy. Other frequent systems would include dizziness after standing. That's because of poor blood pressure control, urinary incontinence, sluggish eye pupil reactions, and impaired sweating. The best way to prevent diabetic neuropathy is to maintain good blood glucose levels if you are diabetic. So then we talk about control of the autonomic nervous system function, and the autonomic nervous system is under the control of the central nervous system. There are centers in the brainstem and spinal cord, hypothalamus and the cerebral cortex. Hypothalamus is generally the main integrative center for autonomic nervous system activity. However, cerebral input can modify the autonomic nervous system, but it does so subconsciously. It works through the limbic system structures on hypothalamic centers. Brainstem and spinal cord. The brainstem reticular formation appears to exert most direct influence over the autonomic nervous system. Medullary centers regulate heart rate, blood vessel diameter, as well as gastrointestinal activities. The midbrain controls the muscles for the pupils and the lens. Spinal cord controls defecation and micturition, but they are also subject to conscious override. Hypothalamic controls in the anterior region of the parasympathetic, they direct the parasympathetic function, while the posterior regions direct sympathetic. They control maybe direct or indirect through the reticular system or spinal cord. So some centers that are important are heart activity, blood pressure, temperature of the body, water balance, and endocrine activity, as well as emotional responses that are activated through the limbic system for the fight or flight system. Cortex, we have connections to the hypothalamus through the limbic lobe that allow cortical influence of autonomic nervous system. And since we can think with our cortex, we can also use the cortex for biofeedback, in which we become aware of physiological conditions and have a goal of consciously influencing them. So we can use biofeedback training to allow some people to control migraines, and certainly to manage stress. So here are our levels of control. Disorders of the autonomic nervous system. Many autonomic nervous system disorders involve deficient control of smooth muscle activity. So hypertension or high blood pressure could be caused by overactive sympathetic vasoconstrictor responses to stress. When that happens, the heart has to work harder. The artery walls are subject to increased wear and tear, and we can use drugs that block adrenergic receptors to treat hypertension. Raynaud's disease is a painful, exaggerated vasoconstriction that happens in the fingers and toes, causes the digits to first turn pale, and then they have a bluish cyanotic color, and that can be treated with vasodilators. Autonomic dysreflexia is a life-threatening, uncontrolled activation of the autonomic neurons in quadriplegic patients and people with spinal cord injuries above T6. It causes blood pressure to skyrocket, and that increases the risk for stroke. Here is an individual with a bout of Raynaud's disease. It used to be that the only treatment for these people was to move to climates where it was not cold. Developmentally, the autonomic nervous system preganglion neurons are derived from the neural tube, just like somatic motor neurons. Autonomic nervous system structures in the peripheral nervous system are from the neural crest, postganglionic neurons, adrenal medulla, and all the ganglia. Nerve growth factor and signaling chemicals aid axons in finding the path to their target organs. During youth, the autonomic nervous system impairments are usually due to injuries. The autonomic nervous system efficiency does decline with old age, but partially because of structural changes at the preganglionic axon terminals. And some of the effects of age on the autonomic nervous system can include constipation, dry eye, frequent eye infections, orthostatic hypotension, that is the low blood pressure after position change, that is the feeling dizzy, standing up quickly, and it's partially due to pressure receptors become less responsive to blood pressure changes, and the cardiovascular center fails to maintain a healthy blood pressure. All right, that wraps up the autonomic nervous system, and I will be posting information about our final later this week.